Hello, my name is Garrett Akers, and I'm the co-president of the Environmental and Sustainable Health IG here at the OUHSC College of Medicine. Thanks for joining us today for this environmental health and environmental justice lecture titled Pesticides and People, Environmental Health and Pesticide Exposure in South Texas, in collaboration with our friends at OU and Norman. Before we begin, I'd like to read OU's land acknowledgement. Long before the University of Oklahoma was established, the land on which the university now resides was the traditional home of the Caddo Nation and the Wichita and affiliated tribes. We acknowledge this territory once also served as a hunting ground, trade exchange point, and migration route for the Apache, Comanche, and Kiowa Osage Nations. Excuse me. Today, 39 tribal nations dwell in the state of Oklahoma as a result of the settler and colonial practices that were designed to assimilate Native people. OU recognizes the historical connection our university has with its indigenous community. We acknowledge, honor, and respect the diverse indigenous peoples connected with this land, and we fully recognize the support and advocate for the sovereign rights of all of Oklahoma's 39 tribal nations. This acknowledgement is aligned with our community's core value of creating a diverse and inclusive community, and it is in its institutional responsibility to recognize and acknowledge the people, culture, and history that make up our entire OU community. Excuse me. And now I'd like to introduce our guest today. Dr. Jennifer Ross is an assistant professor and coordinator of public and community health programs at OU's Norman campus, as well as an environmental epidemiologist. Among her other research interests, she has worked on multiple projects regarding environmental health and has written multiple articles on household and occupational pesticide exposure in both children and adolescents in South Texas. So please help me welcome Dr. Ross.
Thank you. I'm here to talk about pesticides and people, and I will start by sharing my slides. So this is work that was done in South Texas with the help of multiple groups at Texas A&M. I'm going to talk very briefly about focus on children and adolescents, go through some methods that we use to measure pesticide exposure, and then talk about the communities that are involved in these studies. So I focus on children and adolescents. Most of the work done on pesticides is agricultural, so it's occupational studies, usually focusing on adults. And there's a smaller portion of environmental research that's done on proximity to agricultural fields or spray, or where the spray can drift in the atmosphere. But there's a much smaller body of work on residential and household pesticide exposures. So we were interested in residential and household pesticide exposures on children, and also agricultural farm workers. So the reason for this is young children are still developing, and toddlers in particular crawl around and put everything in their mouths. If you've spent time with little kids, you know everything goes in their mouth. So they're going to be very exposed to anything that you spray in a house. And they're still very, very much developing. They don't have a full metabolism yet, so they can't break down pesticides or other environmental exposures the same way that adults can. They also eat more, breathe more, and drink more than if we were shrunk to their size that we would, because they're growing so much. Children are still developing and growing, and now they leave the home and go to school, so they have this extra new potential place of exposure. And then later on, we get to adolescence, and your prefrontal cortex is not completely solidified until you're 25 to 27 years old. So the brains are still developing, and adolescents go to school and work and sometimes travel more than younger children. So they have additional exposures that might make them have different things than other children. So talking about ways that we can measure exposures. This work was done by lots of different groups. Some of the groups I was part of, some of the groups I came in after some of this work was done. So I'm going to tell you a little bit about what we've done. First, we could measure soil samples. So this would give you an idea of what people might have in their yards. So we did some soil sampling of organochlorine pesticides or insecticides in the colonias near Laredo. And so you can see Laredo's down here, down in the border area, and the colonias are right outside the city. We went into places where the families would let us take soil samples, and we were fully expecting to see DDE, which is the breakdown product of DDT, a pesticide that's been banned in the US since 1972. And so we found DDE and other organochlorines like PCBs in the soil. But to our surprise, a couple of our samples had DDT in it, which meant that it was sprayed recently because it breaks down quickly to its byproduct DDE. So that was one of the more interesting findings there. Another thing that we wanted to do was look at household pesticide exposures. And this is very important, particularly for toddlers. Since, like I said, they crawl around, everything that's on the ground or where they can be, where they can reach, goes into their mouth. So anything that gets on their hands goes in their mouth. So you have to be concerned about what's around in the household. And one of the things that's a problem here is, how do you get these kind of samples? If you do like floor wipes, that's problematic on carpet, on tile. If you tell people you're coming to their house, they'll clean it before you come. So you may not get residues. We talked about doing light fixtures because people don't clean those out as often, but because light fixtures get hot, they'll just evaporate off all the pesticide residue. So that wouldn't work. So vacuum dust seems to be a good way to collect this. And there are lots of groups who've worked, well, not lots, but there's a good number of groups who've worked on vacuum dust samples. And they do show that you can find pesticide residues in vacuum dust, and that might have some potential exposure for children. Next, there's a market basket analysis. And we do this because most people are exposed to pesticides based on what they eat. So we're all exposed to pesticides through our food. And it's kind of surprising to most people which foods, people don't think about which foods have them. Like most people don't think of their coffee and their wine as pesticide bringing sorts of things, but they are. So what we did is we went into the community and worked with our lay health educators or promotores and the communities that we worked in to find out what was commonly eaten and where it was bought. And after getting that information, we went to the same stores that people went to. So most of our Laredo and San Antonio participants bought from H-E-B or Walmart or from the food banks. And so we went to the same places, got the food, took them back to the lab to analyze. This hasn't been completed yet, but I can tell you when you dehydrate a carrot, it turns into something like, there's so little left. It's amazing how much of that is water. The other thing that we thought was very interesting is that in some of our packaged foods that we were looking at, there were a couple of cereals that when we analyzed them for pesticides, we found pesticides, but it wasn't pesticides used in the growth of the ingredients. It was pesticides that were sprayed on the cardboard packaging of the items before they were transported. So there's lots of different places you can get pesticides in your food. There's while it's growing, when it's transported to market, when it's packaged, and when it's on the shelves of the store. Sometimes stores have to spray pesticides as well. And so people don't also think about things like your cotton garments. Make sure you wash your clothes before you wear them the first time. Another thing that's pretty common for pesticide exposures is looking at dietary metabolites for organophosphates. And one of the reasons this works out well is the National Health and Nutritional Examination Survey, which is a US nationally representative sample that's done every 2 years. On their 4th national report, they put out percentiles of exposures or dietary metabolites from OPs found in people's urine. So you can get your measures and compare them to national samples, kind of like a height weight chart. You know, am I in the 95th percentile? Am I about normal height? Is my height lower than other people? So you can compare the samples you get and have an idea if it's high or low exposure. This is done with urine samples. So this brings up, of course, trouble. Not everybody wants to collect urine samples. A lot of people don't want to save them for you to come get them. And then if you're working with toddlers, there's a new problem with you can't just get a sample, you have diapers. So you might have to squeeze the diapers to get the urine out. So this is somewhat problematic work, and there aren't a lot of labs that have the capacity to do this well. But it is one way that you can look at exposures in people. The other problem with this is that plants metabolize the pesticides as well. So we don't really know how much of the dietary metabolite is produced by the plant versus us. Another way we can look at these is through data sets. So I've done hospital discharge codes and looked through hospital discharge data sets to see who's been into the hospital for health problems related to pesticide use. And you can also see occupational codes or how they found it. I have a colleague who does a lot more work with this, hospital discharge codes. And she also, Dr. Trueblood, also works with poison control center information. And having the overlap of the two is really useful because you get who calls, who's concerned about the pesticides, who's just asking for information versus who's actually worried about ingestion. And then the hospital codes are for the extreme incidents, because not everybody who ingests pesticide goes to the hospital or understands that they've ingested a pesticide to begin with. I have boxes here around too that I want to point out. Naphthalene is the most common and has been for a very long time. This chart is very different now than it was 10 years ago. I just want you guys to know that the types of pesticides that are most common have changed. But naphthalene is mothballs. And mothballs should not be something that you see everywhere, but you can still buy them. And kids think that they're candy. They look like mints, particularly the colored ones. So you need to be careful if you have mothballs in your house around children. And then this one, malathion, I'm pointing out because it's a strong organophosphate. All these others, this is a pyrethroid. Boric acid is common. You can buy it at the grocery store. It's really good for ants if you use it properly. And then glyphosate because it's in the news a lot. Another thing that people I worked with have worked on was hand rinse samples. What you do with this, if you're interested in children, particularly the children who are crawling around, you want to know what they have on their hands because that might go in their mouth. So what you have to do is get the permission of the parents and then get the child to say that they're okay with it. But you trace their hand like you're making a turkey, right? For Thanksgiving, we've all done that. And then you have a baggie with ethanol in it, and you make sure that they don't have any cuts or scrapes. And you put their hand into the ethanol bag, shake it around, and you can get anything that might solubilize in the ethanol into the baggie. And so then you can check that later for pesticides. Obviously, you want to check their skin so they don't scream and you don't hurt them. And then the hand tracing is to make sure that you're taking into account how big their hand is and taking volume surface area ratios into account. But the hand rinse samples correlate better with dietary pesticide metabolites in children and toddlers than the household dust samples do. So that's another thing to think about. In the adolescent farm workers, we pilot tested finger sticks for cholinesterase. And what this is if you have exposure to organophosphates or carbamates, then your cholinesterase levels, which is the enzyme that breaks these down, or the enzyme that gets bound by these, it actually breaks down acetylcholine that I have my little picture. Acetylcholine is a neurotransmitter between the neurons that tells your body to fire the nerve. So if you get a bunch of OP pesticides, it keeps firing because there's nothing to break down the acetylcholine. So we wanted to look at cholinesterase levels and see if we could use this in adolescents as a way to see quickly how much, if there's amount of exposure they had to OPs in their work. And we found that it was feasible. We did have some problems. Some of the people in the area we were working in did not want us doing this work and made people afraid to let us do finger sticks. And then finally, with the agricultural farm workers, we worked on postural sway. Now, this picture is from one of our publications, and Amit Bhattacharya does this work in occupational people. He also works on firefighters, so that's with the respirators, but we don't generally use respirators in our work. But basically, postural sway is a way to look at how people how people kind of move, right? So you put them on a very glorified Wii Fit, a balance board, and see how much they move just standing still. And everybody moves a little bit just standing still. And then when your eyes are closed, so you take out your visual cues. And then on foam, so you take out proprioception and how well you can feel around you where you are. And we were hoping to use this as an early indicator of problems and health effects coming from pesticide exposure. If you are at OU, the health and exercise science people have some of these boards out for you to look at, which you could see going through their work. But we're still working on this. We haven't done all the data analysis, but I'm hopeful that this might be a good way to see before we get to long-term problems. So finally, we can do surveys, and surveys are very common in the social sciences. We can look at attitudes, we can look at knowledge, we can get an idea of behaviors, and we can look at inventories of what they have in their homes. And so you get a feel for how much people already know about pesticides, which is in South Texas was way more than we expected. I was actually amused that my people in South Texas seem to know much more about pesticides than the people I knew in the Dallas area or in the random people I ran into in College Station who weren't in my group, right? But there are problems with this in terms of delivery and bias. So you're asking people to recall what they've used. You're asking them to tell you and hoping that you're not leading them. We would do these in person with our promotoras, who are lay health educators that were familiar with the communities or lived in the communities. So sometimes it's through no fault of their own, the promotoras might lead a little in asking the questions or help out a little bit more. So that is problematic too in understanding how the surveys work. And then our inventory, where we found out what kind of pesticides people were using, we had some interesting findings. So in addition to finding the typical raid and ant and wasp, which is the most common, ant and wasp are the most common things people spray in their houses in South Texas. There were rat poisons. I know Peter would be interested in that. And then there is these two pesticides, which we found, which are interesting because they're not legal for sale in the US. So we call them illegal pesticides, but that makes it sound like you shouldn't have them. Oh no. So I try to be careful to explain it's not illegal for you to have them, but it's illegal to sell them in the United States because this has no label on it. And this is actually airplane powder, the powder sprayed from airplanes to take care of serious pest. So you should not be using this in your home or in your yard. And we were surprised to find this in lots of places, but the most surprising place for us was in Bryan, Texas, near College Station. We found this at a flea market, and they just had this bin of methylparathion airplane powder, and it said good for ants and cockroaches, which is true. It will kill them, but it's also dangerous for you, so we shouldn't be handling it. And we had to put the sample we collected in 5 baggies to seal off the smell. Then this one is insecticide chalk. And this is pretty common. Lots of people like it. It's really good for killing ants in your home. The problem is you have to draw with it, and it looks like a chalk, right? So kids see this and they want to eat it. So there's a lot of accidental pesticide poisonings of kids eating this thing that looks like a toy. But also if you're drawing on your kitchen counters, kids are going to walk across, touch that. If you're drawing near your plates, who knows where things are going to get on it. And since this is not legal for sale in the US, the label makes it sound like it's completely safe. This says cockroach and ants kills ants and cockroach effectively, harmless to human being and animal, safe to use, which is not true. One of the reasons that we're concerned about this pesticide, even though it's a pyrethroid and not quite as toxic, is because the place where it comes from, it's made very variably, and we don't know how much pesticide each batch has in it. So, and because it looks like a toy, so you don't want it anywhere near children. So now I'm going to talk about the communities that we did our work with. So first, we were in Laredo, and well, not Laredo, but near Laredo, there are a bunch of what we call colonias. And colonias are unincorporated communities that are within 100 to 150 miles of the US-Mexico border. So you can find these all over the southwestern United States. And because they're unincorporated and not part of the city, sometimes some of them don't have good water service. Some of them that do have water service, it gets interrupted and they get boil water notices a lot. And that's only if you're paying attention to those. Some of them don't have good roads. And so anytime there's a rain, everything washes out right down to the Rio Grande. And sometimes they don't have good trash pickup. And if you don't have trash pickup happening regularly, then you're going to have trash sitting out that's going to recruit more pesticides to your more pests to your area and make you use more pesticides. Another thing that we learned from our surveys with this group is that many of these people do not have air conditioning and do not have screens on their windows. So that means pests are going to be coming in and out while you're cooking and doing day-to-day work. So this was an interesting place to work in terms of household exposure because of these extra concerns. And we worked with promotores. So this is one of our promotores in Laredo, Melly, who worked with us for many years and I think still does work with them. And she would help us go out and work with the communities and make sure that all of our, not just introducing us to people and working with us, but she would also make sure that our surveys and anything that we presented to people was written in terms and the correct language, right? So it was funny to me when we would send our surveys to the CDC, they'd be like, well, your Spanish is terrible. Well, no, it's not Castilian Spanish. It's not the appropriate intellectual academic Spanish, but it is exactly right for our area. So that's something you have to kind of work with, right? We also worked in San Antonio. And one of the reasons we worked in San Antonio is because the community we worked in San Antonio is next to the former Kelly Air Force Base. And the former Kelly Air Force Base had used TCE engine degreaser, which was in a lot of water supplies there. So that's a problem. But there was concern in the community about defoliants that were used in the Vietnam War and how they might have been disposed in the area. And so there was a lot of concern about things like Agent Orange, and they wanted us to check that out. So we continued doing our other pesticide work while looking for these defoliants, which we don't have any evidence for finding in the soil there, but there were dioxins in the soil. So I can tell you that. And Agent Orange and Agent Purple, which is a real thing. There's like Agent White, Agent Purple, Agent Orange. So we had some community members who were very concerned about Agent Purple. And at first I thought that was a joke. And then I had to go learn more about it. But the community actually there is very engaged and concerned because there is a high incidence of liver cancer from their trichloroethylene exposure. And so when you go through the neighborhoods we worked in, you'll often see groups that have this purple sign up about clean up Kelly Air Force Base area. But Kelly Air Force Base has been closed. It is now the Port of San Antonio, and they took a huge swath of the soil with them. So other than the stuff that got into the groundwater, you won't see much there anymore. And we worked with the Family Service Association and the neighborhood place there. And I bring this up because that was our community promotores in the area, and because this group had a really lovely social services mall to help people fix their homes and do little things that would make a big difference. So we could talk to them about not just, oh, well, don't spray pesticides. Well, you can't tell people not to spray pesticides if you don't give them an option, right? So how do we fix where the pests are coming into your home? That sort of thing. And then our agricultural work done with different groups of people happened in Starr County. And Starr County is further south, down here in far South Texas. This is an agricultural area. So we were interested in migrant farm workers. The children would come to school late. They didn't start until September. They would leave early and they would follow pass throughout the country following the agricultural work as seasons change. So they're in Texas for part of the year, and then they move north and come back. So these were adolescents. We worked with a high school, a couple of high schools, and some of our promotoras and certified nursing assistants would work with us. Having been a certified nursing assistant in college, it was kind of fun to work with them, though they were always surprised that I knew what they were talking about. So this was a National Agricultural Worker Survey project that was funded by NIOSH. And we found some interesting things here working with these kids. But one of the things I want to point out that was, I thought, very funny in both Laredo and Starr County, they were considered agricultural areas, and Starr County still has a good amount of agriculture. In fact, the neighboring county just a bit south, Hidalgo, got in the news last week about the severe snowstorms because our grapefruit production might have been hit pretty hard there in Harlingen. But there were agricultural work, but at the very beginning, there were far more people doing agriculture. And by the end of our survey time, 2013, 2014, people had transitioned from doing agricultural work to going out to the natural gas pipelines. So we were losing farm workers to the gas pipelines that could pay much more. And the gas pipelines would do things like roll up to McDonald's and take people from McDonald's. Hey, if you come with me and work on the pipeline, I'll double your salary right now. So they could just take people and from whatever work they were doing and put them out on the pipeline. So we had this huge change from an agricultural community to a natural gas community in both Laredo and Starr County. It was much more pronounced in Laredo. So I want to talk a little bit before I finish and show you my acknowledgements about working with these communities. So we didn't start with the full community-based participatory research that I think you really need to do in projects like this, where you involve the community and your people from the very beginning, and you make sure you know what they need and want, right? Because when we went to San Antonio, some people were like, oh yeah, well, we're interested in Agent Orange, but not really about insecticides. And by the way, we have this roving dog problem. And so until you deal with the things that people are concerned about, nobody cares about your project. And you can't go in caring only about your project and not what other people want. You have to have a collaboration to really get in. And if you don't collaborate and work with the community, then they're going to not want to work with you. And that's perfectly reasonable. So we had some problems where, there were some places in the colonias where people didn't really want to talk to random white people coming up to their door, and unless you were with the promotoras, which makes sense to me. There was a whole bunch of people worried about deportation at the time. There was crackdowns, and people who were citizens were in trouble, which is just terrible. So that was one of the problems. And then this whole change in the community from one aspect to another, if you were really working with the community the whole time, you would be aware of this going on, right? So you wouldn't be surprised by changes in your community. And finally, we have a real problem with people coming in and just being like, well, I'm the scientist, we'll do this my way. I'll just educate you on this being a problem and that will fix everything. And this is a real problem. I was thinking, oh, we'll just tell them it's a problem and it will get better. Whether that's, people already knew pesticides are a problem. This is like me telling you, you shouldn't eat a lot of Cheetos. We all know this, but people still snack. So I just want to finish by saying it's very important to always engage with your community, to know what concerns your community has, and to make sure you're helping them address those concerns, or not just imposing your will upon who you're working with. So I'd like to make some acknowledgements about the people I worked with at A&M. For the child focused projects, this was done with Dr. Chismas, McDonald, Trueblood, and Donnelly, the late Dr. Donnelly. And they're at the Texas A&M School of Public Health, the Texas Transportation Institute, and in veterinary toxicology. We also worked with colleagues from UT Health Science Center in their STEER program, their South Texas Environmental Education Research Projects. And that work was funded by the CDC, ATSDR, and the EPA. And then the NAWS project was with Dr. Eva Shipp and Dr. Amber Trueblood, who were at the Texas A&M School of Public Health and are now at the Texas Transportation Institute. And so they're doing traffic epidemiology now, looking at migrant farm worker transport in a different way, right? And this work was funded by NIOSH. So thank you.
And thank you for coming to speak to us, Dr. Ross. So at this point, we are ready to take some questions from the audience. If you are interested in doing so, there's that email right above my head. You can send any questions you have there. The first question I want to ask is about the pesticides that you're working with. And so you had briefly talked about these pesticides effects at the level of these neurons and how you were tracking those effects through the fingerstick testing. The question is, these pesticides, because they tend to be cleared pretty quickly, what is the concern since they are able to be cleared relatively quickly from the body?
So they are cleared very quickly from the body. You won't find them in the blood more than 48 hours after spray. You might find cholinesterase changes, though, long term. And so the concern isn't how much pesticide you have in your body, but the changes it makes to your body. So you're producing less cholinesterase. And that's one way that we were looking at the finger sticks. And some of the concerns are most people don't get acutely exposed to pesticides, but everybody's concerned about what my long-term exposure is from the things I just run into in normal day life.
Okay, so there's also this concern perhaps about not only just the acute effects of being exposed, but also perhaps changes that are happening due to this chronic exposure. You even mentioned perhaps changes in the amount of cholinesterase that one produces. That's interesting, very interesting. Thank you. So another question we had, and I think you elaborated on this a bit, but I think this person would like to hear a bit more about it. So what exactly, or who exactly are these promotoras? And it sounds like they're kind of serving as bridges to the community, but what else are they doing?
So the promotoras are people who already live and work in the community. And the promotoras we worked with had already been working on other health-related projects. Many of them were working on lead and paint outreach in their communities, because that's a huge concern for children under the age of 6. And any house that was built before 1979 is going to have lead paint in it somewhere. So they had already gotten used to doing environmental health outreach, and we worked with them because they already knew the communities. They already had the ability to talk to the communities about environmental health. But in South Texas, in Laredo, the promotoras were a different group. They were already working with the SEER program, but these are people who live in the community, speak the language that people in the community trust and recognize, and that can work as a liaison, not just for doing education and helping you go out and collect samples and run into people, but they also help connect you to the broader community, who you can meet in the community, making sure we would go to community meetings that they would find out about. And so in San Antonio, for instance, one of the first community meetings I went to had the mayor there, and that was kind of interesting. It was my first time to run into Julian Castro before anybody knew who he was. And so it was nice to be there. And then you can get a broader idea of what people in the community are concerned about, instead of just the people who are working with you and interested in things you want to do.
I see. And so you had mentioned that these promotoras are also really involved in education with these communities you're working with. And you had mentioned previously that there's this issue in doing this research about, coming in, being the big bad scientist who gets to tell everybody what to do. What kind of education for the communities came from this kind of work?
What kind of education for the communities? So when we would go out into the communities, we would do, the promotoras actually would we'd make a notebook folder, and we would have flip book basically. And on one side would be what the promotora could see, and the other side would be what the participant could see. And they would go to homes and train people on, here's pesticide issues, or here's common household issues. So sometimes it wouldn't be just pesticides, it would be electrical outlets and spills, and sometimes it would be nutrition, right? So we did a nutrition module too, and I thought the nutritional module personally was too long and had too much in it, because you really need to focus when you do this kind of work. People can only retain so much. But we found with the nutrition module, the thing that people really focused in on was drinking soda pop, right? So how much sugar is in soda pop, and what does that do for your caloric intake? So I thought that was kind of interesting. But with the pesticide stuff, they would be, here's how you stop pests from coming into your home. Here's how the types of things that you can spray. Here's ways to make sure it's less bad. We want to know what you're using, and where do you store these things, and how do you mix them, if you mix them at all, because mixing them becomes very problematic, right?
I see. And so I guess as a bit of a follow-up to this line of thought, you were talking about how there's almost a kind of transactional thing going on here, right? Like you have to also offer these people something for them to really want to work with you. Just speaking in terms of the methods you guys were using to interact with the people in your areas of interest, is there anything that you would change about the way you went about addressing the issues that these people have, or including STEM in these projects?
I would want to start from the very beginning, including the promotoras, in deciding what exactly we were going to do, because the first pesticide module was developed and put out, and then we talked to the promotoras about it. And I would really think that it would be better if we'd started with them and had their input. And then we had to do lots of changes on things like questions that were worded weirdly in Spanish. And my Spanish isn't great, so I definitely need people to help me with that. And particularly local Spanish, right? And my advisor, Dr. Chismas, speaks Spanish fluently, but she learned in Costa Rica. So there were little changes, right?
As someone who got a Spanish minor from OU and studied mostly Spanish, like Castellano, like you were saying, I know exactly what you mean. It's very, very different.
Exactly.
So the person who had asked that previous question was also interested in like an urban-rural divide that you had mentioned amongst, I guess, the people you were working with. Could you speak more about that?
So urban-rural divide, and the colonias are urban in that they're right next to a big city, right? They're basically suburbs, but they're rural in that they're subdivided, they're not incorporated, they don't have all the things that the city would have. And many of the people who lived in those communities, families would have one car. And so if the husband went to work, then the mom and the little kids would be home all day. And so where can you walk? Where can you get stuff? Who are you connected to that way? So there are additional challenges there, right? In San Antonio, it was very different because it was harder to connect people in the Laredo colonias to other services and help. In San Antonio, it was very easy to be like, oh, well, there's a social services mall. We'll help you get, we'll help you connect to them, and we'll help you get air conditioning in your home. Because there was a program at the time under the Obama administration that was helping people get air conditioning in homes that were older or people who had done certain groundwork in their home to make sure that they could do it. Or they had that social services mall with a tool library. So you could go and learn how to fix a hole in your wall and make sure pests aren't coming in. In the colonias, it was like, well, you could get some steel wool and stick it in that wall place and try to plaster over it, right? But you can't just put something there and hope it doesn't work. So there were some real differences in terms of not just what they're exposed to, but also what resources they have to fix that.
Now that's fascinating. I know in research, it's so common to offer someone an Amazon gift card or something for participating.
We offer Walmart gift cards for participating in our surveys.
Interesting that you guys did too, but also really interesting that some of these incentives you had were so practical. Not to say that a Walmart gift card isn't. Who wouldn't love?
Well, that was one of those good community involvement things. What would you want, right? Because you have to be careful with the reimbursements, right? That's what we call it for survey research. That I'm not giving them too much. That I'm not giving them undue pressure to do my survey or let me do soil sampling for them. And where would you actually use it? If I go in and give you an Amazon card and you don't have internet, then I haven't really helped you, right? But for most people, I would prefer an Amazon card, but I don't know if everybody would.
And I think that really speaks to the necessity of having people who understand these communities and what they actually need or want.
Absolutely.
That's very interesting. So shifting gears a little bit, there's a question about the pesticides in the kind of the home versus agricultural field. And so the question is, what's this, I guess, balance of risk versus reward between using these pesticides in the home and the agricultural setting? And like, is there one setting where you're finding there's a lot more harm as opposed to the other one?
Well, the pesticides that are sprayed agriculturally are stronger and are typically more higher toxicity because they're sprayed outside and they're supposed to last for a long time. But the balance there is different, right? Because you're not just concerned about, maybe you had a few bugs in your home, but now you're concerned about the crops being eaten, right? So it's a very different concern. So there's a different level of balance. So the stuff that's sprayed agriculturally it's much more of a problem if people are highly exposed to it. So when those things are sprayed, people should not be out in the fields while they're being sprayed. And that's just one of those weird things that people have to pay attention to. And there's a lot of trainings that are required for agricultural workers in dealing with pesticides that sometimes don't really make their way all the way to the migrant adolescent farm workers. And that was one of the more interesting things we found, is that some of the things in the trainings either they didn't know, or the things that they did know, some of them they rejected outright. So one of the things is making sure you wash your hands after you touch the crops that might have pesticides on them, and making sure you clean up before you go home. And people would be like, well, the only water that they give us when we're out in the field is ice water in this big igloo jug sort of things. And you can't wash your hands with cold water. That's bad for you.
Oh.
And so they'd just be like, no, it's not a good idea. But they would, still do things like go home and change their clothes before they hold their kids and things like that, right? So it's interesting what things work through. Then with the household pesticides, we've had changes over time in what you can buy at the stores. And the stuff that you can buy at the stores is much less neurotoxic. There are some issues with mixtures if you spray a lot of different kinds of pesticides. And because of all this work I do, I try very hard not to spray them at home. But the moment I see a bunch of spiders, then I call someone, because that's my threshold. I do not like it. I was not going to get a pesticide service in Oklahoma until I found a nest of black widows. And then I was like, nope, it's time. But I want a professional to do it because they know how to do it and where to put it. And then it's not in my house, it's outside my house, right? So it's just, but wasp spray is pretty common. And I understand that if I had a bunch of wasps in my house, I would want to spray them too. And I've used it outside when I had a bunch of wasp problems in Bryan.
Mm-hmm. I think it's really interesting. Oh, go ahead.
Oh, but I'm less concerned about that than I am about the agricultural pesticides. So a little bit outside or a little bit inside on rare occasions is not a big deal, especially if you have a professional do it and you keep kids and pets out of that area for about 24 to 48 hours.
So one of the things that came up in your talk was these migrant children who were also sometimes working in these conditions who get exposed to these pesticides, right? And you said you were doing some I think tracking, or I guess maybe analysis of what was going on with them. Could you speak more about that?
Well, we did have Dr. Ship and Dr. Cooper, who were on the NAS project, have papers tracing where the migrant farm workers go. So they start in South Texas, and there's 3 pathways up through the United States where some groups split off and go west very quickly. Some groups go north to Michigan, some groups go over to Washington State. So it depends on what kind of agriculture. There are some that go east too, but you know, Washington State with the apples and cherries, and California, obviously, with the salad basket of the United States, and up into Michigan, and sometimes more east, but those are the main routes that the migrant farm workers follow. So they'll move throughout the year, and they ride trucks, and they don't get, they just keep moving and keep going on, and then they come back to start over for the next fall.
So as a follow-up to that, were you aware of anybody, or were the people you were working with even assessing some of the health impacts of the work they were doing in this kind of cohort, these migrant children who are working in these pesticide exposed fields?
I'm not sure exactly what the question is, but most of the children were US born, just their parents weren't. So there's that sort of thing. And a lot of times in these communities, everybody would do this kind of, a lot of people do this kind of work, not everybody, obviously, but a lot of people do this kind of work. I'm not sure I understand the question.
Yeah, so I was really just following up about within that cohort we're talking about. Do you know if anyone or if you guys were assessing the health impacts of these things that these people are doing?
Oh, right, the health impacts. Yeah, we were trying to get to that with the finger sticks and the postural sway. And we also did blood pressure studies on our adolescents. That's published, right? And doing blood pressure on adolescents is interesting, or children is interesting, because the guidelines that we all think of as correct blood pressure are for adults. And so children's blood pressure and adolescent blood pressure is different. And that's something people have to pay attention to. And I think MDs are aware of this, but I don't think the broader public health community is aware of this, if that makes sense. So we were looking at different things. With the postural sway, we were concerned about if they were going to have long-term neurotoxicity, long-term events, the intake of the pesticides might cause them to over time develop neuropathies, or people have very long-term chronic exposures, may later in life get things like Alzheimer's disease or Parkinsonism, especially if they've had a traumatic brain injury to go with it. So we were looking at that postural sway as maybe a way to see earlier indications before there were serious neuropathies.
Oh, wow. That's really fascinating research.
Thank you.
I do remember going over some of your papers previously, but I'll have to go back and read some of those again. We had a question about the promotores again. Somebody was wondering, so these promotores, they're working with you guys and interacting with the community. Do they have a role in actually setting the research agenda in terms of like what kind of questions you're asking, or do they provide feedback that kind of shifts your focus or implementation of your research?
It depends on the group, right? So we did have a lot of input from our promotores, and I think that's important. But I know that some people just go, here's what we're doing, and bring the promotores on board. So I think it's you do a better job if you bring the promotores in from the beginning or involve them throughout the process. And you're going to communicate better if you have the promotores involved the entire time. And in Texas, Oklahoma is different. In Texas, there is a certification for promotores, and there's a lot of discussion over whether that's bad or good. Are we educating them too much, or so they can't communicate this like a normal person anymore? That sort of thing. But there's centers, and there's a center in Texas where you can send all your trainings and work with where you can get promotores. Oklahoma, I think, is starting to get to that point. There are a lot of lay health educators in Oklahoma, but there's more involved in the tribal communities here.
Okay. So the promotores then, they don't have as much of a direct role in terms of, because I know you said like your promotores, for example, are very well integrated into your research, like as the kind of the ground floor. But it's not typical for them to be people who are providing feedback that actually guides the research. Are they often used more as a liaison?
They're typically liaisons. They're typically liaisons between you and your community. But most people do listen to them because you really do need their feedback. But there are people who don't. So it really depends from researcher to researcher, but I'm pretty sure most researchers have good relationships with their promotores and are interested in what they have to say. Otherwise, you're not going to get the full extent of the work you can get, or really understand your community as well.
Absolutely.
I mean, I'm very number biased, but having the stories makes people listen.
Absolutely. I think that affective, emotional relationship or way of communicating is probably going to be more effective than throwing the book at these people.
Exactly.
So here's a question. Say I want to do some kind of environmental epidemiology or public health research that requires the use of a promotor. How do I find one? How do I get in contact with these people? And are they working with some grand, huge organization, or are they just community members, or is there something in between?
So like I said, in Texas, there's certification, so you can look for them and you can advertise for them. In other places, you can either see if there are any in your area. And I was asked this from OUHSC back in 2014. They were looking for promotor for men to work in the agriculture, not agricultural, but manufacturing community. So and there's no setup like this in Oklahoma City like there is in Texas. So one thing you can do is ask for, advertise for community health, lay health educators, or you can go to your research area and see if there's people that might work. Just try to make connections with people who might work who are interested in helping other people within their community, or you might find people who are already involved in other projects or other organizations, and then they would be really good people to bring in. So if you've got people who are involved in like a social justice or an environmental justice group, or you've got people who are involved in an occupational specific group helping other people in that occupation, that would be a really good place to look. Because they're already going to be connected and know about stuff, and people are already going to listen to them.
And so it sounds like almost all of these sources are more or less kind of independent contractors or community members. So the health department, for example, probably doesn't have a retainer of promotores to work with.
No, they don't. Health departments don't have that kind of money.
Oh, that's unfortunate. But very interesting nonetheless. So I think that might be all of the questions I have. Do you have anything that you'd like to expound upon in the brief moment we have left?
I would like to just plug community-based participatory research, making sure that if you are going to go in and work with the community, that you take what the community needs to heart, and that you're willing to listen to them and work with them, as well as, approach your research agenda, because you need to do both. And I'm a big fan of outreach as a public health person, so I enjoy doing that sort of thing. Not all researchers do, I understand that. But so if you want to talk about outreach or something, I'm always happy to help with that as well. I do a lot with junior high school level kids.
Awesome. I'm glad you're getting the kids involved early. Well, thank you for joining us today with Dr. Jennifer Ross, who is the coordinator of community and public health programs at OU in Norman. If you want to read Dr. Ross's article, you can go to the Inhabiting the Anthropocene blog, where she has some content up, and there's some discussion going on about that content. And lastly, we'll be having the next talk next month, I believe March 26th, with Dr. Joe Nation from Stanford, who works with environmental and health policy. Thank you, guys.